If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question: what are some of the specific mechanisms that cause type 2 diabetes? Answer by Rajinder Bala. Body is 65 to 75% fluid. This total fluid is divided in 3 compartments. 10% is blood. Rest of the 90% fluid divided into cells and space between cells. Any weight gain results in imbalance of fluids in these compartments. The increase in blood volume is usually less than increase in rest of the fluids. There can be fluid imbalance in these compartments without weight gain as well. Let us say that a person has 4 liters of blood. Rest of the fluid is 40 liters. Glucose is essential for survival. Without glucose we cannot survive for even few minutes. When a person gains weight he may not gain much blood volume. Even if he gains blood volume, the increase will not be sufficient to allow the same amount of concentration of glucose in above 90% fluid in cells and space between cells. That will cause lack of glucose in cells. That will result in low resting metabolic rate. That is emergency situation. The body increases the blood sugar in order to compensate for increase of fluids in cells and in space between cells. This is called insensitivity of cells to pick up insulin or glucose. This is not so. The body tries to fight this in 2 ways, making more urine and by increasing the blood glucose. A person who has high blood glucose usually loses weight easily if he exercises or becomes more active. That is mainly fluid loss. And then comes the advice of walking and exercises. He overtrains. He does more than what was necessary. And that causes less allocation of energy for heart and buildup of more fluids after some time. One should reduce exercise and rest more often once he has lost weight. Allow the body to allocate more energy for his heart so that fluid buildup can be stopped. To understand the concept, read my blog. In brief, one should do the following to get rid of diabetes permanently. Chronic mineral imbalance in blood leads to low metabolic rate, resulting in aging and age-related diseases like blood sugar, blood pressure and heart disease, etc. To correct mineral imbalance, do hydration-dehydration cycles, and to increase resting metabolic rate, do walking and rest routines as detailed on my blog. Read my blog for more details or watch my YouTube videos at Rajinder Bala. To increase resting metabolic rate, RMR, do the following. Walk for 5 minutes at easy pace within your home in the morning. After walking, rest for 510 minutes in bed. Repeat the above 3 times in the morning, afternoon, evening and at night before sleeping. So that makes for 12 walk and rest routines, or 5 by 12 equals 60 minutes of walk for the entire period. One can do it selectively during weekdays and on working days only in the morning and at night. If the migraine is just setting in, walk only for 1 minute or even less and then rest for 5 minutes. Repeat till migraine disappears. It will be complete relief in 30 minutes or less. The idea about walking is that it mobilizes energy, and before the entire mobilized energy is spent, we rest. In such a case, a part of the mobilized energy becomes available for vital organs. This mobilized energy takes care of the migraines. Doing walking and rest routines takes care of aging-related diseases as well. In brief, hydration-dehydration cycles is as given here. Day 1. Drink 150,200 milliliters water every hour from 7 a.m. to 6 p.m. No other fluid/liquid. Day 2,3. Drink 150,200 milliliters water 3 times only during the day. Total fluid intake 450,600 milliliters in the day. Repeat for 23 weeks. Fluid overload is one of the basic reasons of low resting metabolic rate. For explanation of the above, read my blog.